I'm here talking about my my thoughts over IPE Day. Honestly, it wasn't really anything that I didn't expect it to be. Yeah, I did learn quite a bit when I was there, but I had a decent. I believe I had a decent understanding of why it's important to include all the rest of the fields of practice in your treatment of the patient, so that way they can receive the best patient care possible. One thing that was really nice about it, I was able to converse my role in the healthcare system that many other practices probably don't realize within my group. So, especially during the the patient case, I believe I put a lot of good input that wouldn't have came up if I wasn't there. I mean, there was a few things that the PTs had similar to what I thought, but specific to the injury, I think that I brought something to the table that no other practice could. Starting off, one of the things I didn't learn at IPE Day was the difference between PT and OT, which I had to ask you and Doc a couple days after. One thing I did learn is that pharmacy students' knowledge of healthcare is a lot more extensive than I thought they would be. I kind of assumed that they only dealt with medications, but it's their knowledge of the effects of medication compounding one on top of the other, what you can and can't do, which systems one medication affects versus the other, so whether you can take them at the same time. And I guess I can see why they are kind of pushing towards wanting to distribute medication without the approval of a DO, but I see a physician, but I see why it's not going to be, or probably isn't going to be, a thing. Their knowledge allows them to understand how disease works in the body and how medications acts to it, but I'm not sure if that is the level of administering medication. From the guest speaker at the end, I didn't really learn, but I guess it kind of opened my eyes to communicating not only within professionals, but also being able to bring it down to layman terms and have the patient understand what you're talking about when you're pretty much right next to them and treating them versus talking around them. I didn't think that would be a problem ever, but I didn't think it would be that big of an issue within the healthcare system. And the last thing I learned is that we need to take this gen med class, because that trivia was very hard, and I guess my understanding of general illnesses with the human body isn't that extensive. We've had a couple, here and there is on learning about illnesses, but it's mainly been physical and psychological, if anything, not actual bacterial or viral infections. I believe my interactions with the other students from other programs went well. Now that I'm thinking back on it, I may have came off kind of arrogant when I was talking about me handling athletic injuries, and then I pretty much handle my patient until I need their help. I realize that it sounds kind of arrogant now thinking about it, but my interactions went well, and it's important to make sure that you're talking with them and developing relationships within the healthcare system. Because, like Dr. V said, when he was talking about the chiropractor in town that he became comfortable sending athletes to, it's just he walked in there and said, I want to tour your facility. He just kind of like walked in and introduced himself, and it started off that way and became a understanding between the two's profession, and became an understanding of the two professions and relation to how they could work together. If you don't have a general understanding of how you can work as a team, then I see IPE Day being important. It could be very eye-opening to some people. The main thing that I believe was the best portion of IPE Day was the patient case, because it literally forced each it forced each group or each different groups of students to bring to the table what they know and what they have to offer and what they've been taught. So there's the medical standpoint from the pharmacology students. There's the viral bacterial standpoint from the DOs that were in the group. There's the acute rehab portion from the PTs and OTs. And then there's the athletic portion that I brought to it from. And then I guess with the two-third issue that you brought in there, you brought in the dental students as well. But it gives an opportunity for everybody to present what they can contribute to making patient-centered care a thing. And this has been my reflection of IPE Day.